Welcome to the Harvard Health Minute. I'm Dr. Terry Schrader. Millions of Americans suffer from addiction, whether it's addiction to prescription opioids, illicit street drugs, or a dependence on alcohol. But there are many misconceptions about addiction, and to help clear those up for us today is Dr. Michael Bierer, Assistant Professor of Medicine at Harvard Medical School and an addiction specialist. What is the biggest misunderstanding about addiction, Dr. Bierer?
The biggest misconception is that addiction is a failure of will or a moral failing or something about which people have complete control over and should feel ashamed about and guilty about.
But there is a genetic predisposition and a biologic basis I know you've spoken about. What is that with addiction, and how is it similar to, say, diabetes or cardiovascular disease?
So, people don't choose their genes. They don't choose their parents. And people with first-degree relatives, brothers, sisters, parents who have an addiction have 4 times the likelihood of the rest of the population of developing an addiction. So there's a genetic component, and like other diseases, that makes it more likely that you'll develop the disease given certain circumstances. In the case of addiction, if you're exposed to the drug, if you're exposed to alcohol, and you have this predisposition, you're more likely to develop the disease.
What's the most important thing you say to patients about management of addiction or even recovery?
The most important thing is that your life is ahead of you. You can make choices to get treatment, that it's not your fault that you have this disease. It is your responsibility to get treatment.
And when you talk about management of addiction, do you think the medical community even understands what that means?
Management, like other diseases, has to do with pharmacology, medications that help people not use the drugs or alcohol that are problematic for them, as well as learning skills and behaviors and therapeutic techniques to get better.
How would patients know if they're beginning to have a problem, if they're worried about having an issue with substance abuse?
Right. Well, I think that's a good question. If someone has a developed problem, it's sometimes pretty obvious. But if it's the beginning stages, then I think the thing to look for is, am I overly preoccupied with the next drink, the next drug, the next fix? Am I thinking a lot about it? Am I constricting my activities? Is it getting in the way of things that I care about, like relationships or work? And am I doing it more than I intend to do it? Am I losing control?
And if that's the case, what should they do?
I would suggest sharing your worries with somebody you trust, sharing your worries with your doctor. The medical community is getting more attuned to being able to help people and to not blame people. That's important.
But seek help. Ask for help if you have a worry that either you're having a problem or someone you love might be having a problem.
Yes.
Terrific information. Thank you very much, Dr. Bierer.
You're welcome.